Good morning, ladies and gentlemen, and welcome to this parallel leaders session dedicated to health products manufacturing. The Global Gateway Forum is the opportunity for all of us to take stock of the concrete actions that have been and are still carried out in various parts of the world. And definitely following the COVID pandemic, it has highlighted the need for sounder national health system all over the world, secure supply chains, and local manufacturing development. So from manufacturing access to vaccines in Africa, to partnerships on vaccines, products and health systems resilience in Latin America and the Caribbean, the EU is committed to enhancing healthcare systems worldwide. In this session, in particular, we will discuss how we can best combine public and private action for the local manufacturing of health products. We'll see how we can diversify value chains in order to best meet local needs and improve resilience in health products. Challenges remain, obviously, but the next steps will be highlighted by our speakers, and they will help us inform the future developments and the future projects. So to share his experience and the experience of his country, I would like to welcome our very first keynote speaker this morning. Ladies and gentlemen, please welcome His Excellency Macky Sall, President of Senegal.
Merci beaucoup, chers amis. Monsieur le directeur général de l'Organisation mondiale de la santé, cher Tedros, mesdames et messieurs, à vos rangs et qualités, je voudrais me réjouir de cette session qui est consacrée à la santé et rappeler que la pandémie Covid-19 a révélé au grand jour l'état d'impréparation du monde face aux périls sanitaires transfrontaliers devenus, hélas, de plus en plus fréquents. Pays du Nord comme du Sud, nous avions, certes à des degrés divers, manqué au début de la pandémie des masques, des respirateurs, des lits d'hospitalisation et des équipements essentiels pour lutter contre cette maladie. En Afrique, la carte sanitaire et le plateau médical restent encore déficitaires, malgré les investissements consentis ces 3 dernières années. Ainsi, au Sénégal, pour faire face à l'urgence de la Covid, nous sommes passés, au moment de la déclaration de la maladie, d'un centre de traitement des épidémies à 52 centres 1 an plus tard. Parce qu'il a fallu avoir ces centres de traitement, avoir des centres de diagnostic. Et ces dernières années, nous avons aussi multiplié la construction d'infrastructures, notamment un hôpital spécifiquement dédié au traitement des maladies infectieuses et tropicales, mais aussi la construction de près d'une dizaine d'hôpitaux avec des plateaux tout à fait relevés. Mais le plus important reste la qualification du personnel, le recrutement de médecins, de biologistes, de géoscientistes ou de bioscientistes. Et à ce niveau aussi, je pense que nous avons encore des besoins, surtout dans la perspective de production de vaccins. Mais de façon générale, l'investissement public et privé dans le secteur de la santé reste un défi pour l'Afrique. Il en est ainsi de la fabrication des vaccins. Et selon les estimations, l'Afrique consomme environ 25% de la production mondiale de vaccins. Et elle ne couvre même pas 1% la production de ces vaccins. C'est la raison pour laquelle, pour combler ce déficit, CDC Africa a lancé le partenariat pour la production de vaccins en Afrique avec comme objectif la couverture de 60% des besoins africains en vaccins à l'horizon 2040. Donc ça, c'est l'objectif. Des pays pionniers ont travaillé dans ce sens depuis 2 ans avec nos partenaires dans l'Europe et certains partenaires sur lesquels je reviendrai. Il s'agit notamment de l'Afrique du Sud, de l'Égypte, du Maroc, du Ghana, du Kenya, du Nigeria, du Rwanda et du Sénégal. 8 pays travaillent pour être des hubs régionaux. C'est à ce titre que l'exemple de l'Institut Pasteur de Dakar, qui est un exemple qui mérite d'être souligné, l'Institut Pasteur de Dakar qui, pour rappel, fabrique déjà depuis plus de 80 ans le vaccin contre la fièvre jaune. Et il est en train de finaliser présentement la construction d'un vaccinopole qui comprend notamment une unité de fabrication de vaccins avec toutes les technologies, y compris celle de l'ARN messager, un centre de recherche et de développement et un centre des métiers du vaccin dédié à la formation des ressources humaines du Sénégal et des autres pays africains. Alors, ce projet a nécessité un investissement de 300 millions de dollars mobilisés. Je remercie vivement ici les partenaires qui nous accompagnent dans la réalisation de ce projet, notamment l'Allemagne, la France, les États-Unis d'Amérique, l'Union européenne, j'allais dire la Team Europe, pour faire un peu dans l'air du temps, la BEI, bien sûr, qui est dans la team, mais également la BAD, Banque africaine de développement, la SFI, la Fondation Mastercard, la Fondation Bill et Melinda Gates, salut Omar, et la Coalition pour la préparation aux épidémies et l'innovation. Donc, c'est tous ces acteurs qui ont joint leurs forces pour mobiliser ces 300 millions de dollars qui permettent aujourd'hui de développer ce vaccinopole à travers l'élément clé qu'on appelle Madiba, qui est la manufacture de production de vaccins. Et évidemment, en même temps, il y a le développement du vaccin anti-amaryle, donc contre la fièvre jaune. Là aussi, l'Institut continuera à développer ses productions. Alors, je voudrais saluer par ailleurs la collaboration dynamique entre la firme belge Universelle et sa filiale Enjima et l'Institut Pasteur de Dakar, ainsi que les universités sénégalaises, dans le cadre d'une collaboration qui porte sur la recherche, la formation et la production de vaccins. Ce genre de partenariat euro-africain dans des technologies de pointe mérite d'être souligné et d'être encouragé. En matière maintenant de production et de commercialisation de vaccins, nous avons au moins 3 défis. 3 défis majeurs. 1, ça va être la disponibilité des ressources humaines qualifiées. Il faut des compétences. Le second défi, c'est la mise à niveau de la réglementation. La régulation. Et enfin, le 3e défi, c'est l'accès aux plateformes de vente à des prix compétitifs. Que malgré tous ces efforts, je me dis, ouais, mais bon, c'est des vaccins fabriqués en Afrique, des vaccins tropicaux. Si Gavi, si les partenaires, les fondations qui financent et les gouvernements du Nord n'aident pas à mettre ces vaccins dans les plateformes de commercialisation, eh bien, nous allons travailler pour rien du tout. Donc, ce serait vraiment jeter de l'argent par la fenêtre. Il faut donc que nous continuions à travailler sur la qualification, la formation, sur l'intégration des plateformes, afin que les vaccins produits en Afrique soient consommés en Afrique, que le besoin est énorme. Enfin, nous devons faire avancer cette initiative dont j'ai parlé tantôt, qui est l'initiative des hubs régionaux pour améliorer la riposte aux situations d'urgence sanitaire par un acheminement rapide des produits et matériels. Le financement de cette initiative, soutenu par l'OMS, dont je salue le directeur général, M. Tedros, ce financement donc est estimé à 145 millions de dollars US Et le Sénégal soutient cette initiative qui a déjà mis à la disposition de l'OMS une assiette foncière nécessaire pour l'implantation d'un hub régional dans une zone contiguë à l'aéroport international Blaise Diagne de Dakar. Voilà, mesdames et messieurs, les quelques remarques que je voudrais faire en guise d'introduction et je me tiens naturellement à votre disposition.
Merci, Mr. President. Thank you very much, Mr. President. I would like to insist on the fact that cooperation is, of course, needed. It's needed also with international organizations. And that is why it's a pleasure to hear this morning from WHO. And please welcome Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization.
I'm trying to make myself free from the cane, so short distance I try without the cane. Because still I was really worried when I walked without the cane. Your Excellency, President Macky Sall, Commissioner Kyriakides, and Prime Minister, Excellencies, Honorable Ministers, dear colleagues and friends, the COVID-19 pandemic shone a bright light on the inequalities of access to life-saving medicines and health products in low and middle-income countries. It also highlighted the importance of increasing the capacity of all regions for the sustainable production of effective, safe, and affordable health products, and the need to end the stranglehold of manufacturing concentrated in just a few countries. Expanding local production and strengthening local regulatory capacity are essential for reducing health inequities between and within countries. This will not only help us prepare for the pandemics of tomorrow, but to treat the diseases of today. In the face of these challenges, I thank the leadership of the European Commission, especially to President Ursula von der Leyen and the European Union member states for the Global Gateway Strategy and other initiatives to improve access to medicines and health products. The Global Gateway brings concrete technical and financial support to help turn our shared vision of equity into reality by bolstering innovative research and local manufacturing. And WHO is proud to partner. I commend the Team Europe initiative on manufacturing and access to vaccines, medicines, and health technologies in Africa, and the European Union and Latin America, and the Caribbean Manufacturing and Health Partnership, in which WHO is involved. WHO and the EU also work together to strengthen regulatory authorities in Africa through the Africa Medicines Regulatory Harmonization Initiative and through support to the African Medicines Agency in Rwanda. I thank the European Commission for supporting the COVID-19 Technology Access Pools, CTAP. CTAP allows developers of COVID-19 therapeutics, diagnostics, vaccines, and other health products to share their intellectual property and know-how. CTAP is now evolving to mobilize both publicly and privately funded technology holders working on products for a wide range of high-priority diseases. With the assistance of the European Commission, WHO is also leading the mRNA technology transfer program to build sustainable manufacturing capacity in low and middle-income countries. This will allow countries to rapidly produce mRNA vaccines for COVID-19 and other global health threats, including malaria, tuberculosis, and cancer. The hub now has a network of 15 partner countries around the world: Argentina, Bangladesh, Brazil, Egypt, India, Indonesia, Kenya, Nigeria, Pakistan, Senegal, Serbia, South Africa, Tunisia, Vietnam, and Ukraine. Also Rwanda, working with BioNTech and supported from EU. And I note the positive development in the 15 countries and in Rwanda. Your Excellency, President Macky Sall, I commend Senegal for its contribution to the mRNA technology transfer program for building mRNA manufacturing capacities in low and middle-income countries. I would like to recognize the potential of Senegal with Institut Pasteur de Dakar, with its research expertise and competencies, to contribute to the training of a Francophone workforce in Africa in mRNA and other biological research. Thank you, Your Excellency, President Macky Sall, for your continuing support and leadership. Finally, I invite you to join the upcoming second World Local Production Forum in The Hague, Netherlands, from the 6th to the 8th of November, which is organized by WHO and hosted by the government of the Netherlands. In closing, I would like to highlight 4 priorities for achieving accessibility, quality, and affordability. First, as we face increasingly complex and interconnected threats to our health, I encourage the EU to build on these successes and continue investing in health through the Global Gateway and other instruments in line with the bold commitment of the EU Global Health Strategy. I encourage other donors and national governments to consider this example. Second, the private sector should contribute to international efforts for improved equitable access for health products by sharing data, intellectual property, and know-how to allow scaling up of manufacturing in low and lower middle-income countries. It's also important to note that local production of medical countermeasures will be fragile unless the supply chain is strengthened, including through regional production of key supply chain elements. Third, international collaboration is critical. We need closer coordination and better alignment with global mechanisms involved in the development, manufacturing, and supply of needed health products and technology, such as the Global Fund and Gavi, and to support existing initiatives like the mRNA Technology Transfer Program and CETAP. I'm glad that Peter Sands, my good friend, is participating today in this panel. And fourth, it does not stop at the manufacturing. Other measures are needed to make health products affordable and available to those who need them the most. This includes strong policies for improving affordability and reducing out-of-pocket expenditures, and efficient procurement and supply management for maintaining continued supply of quality-assured health products. WHO is committed to our ongoing collaboration with the European Commission and also governments, especially the upcoming presidency of the EU, Belgium, and Minister Caroline is participating today, and of course the private sector, civil society, and other stakeholders to realize the vision of a healthier, safer, and fairer world for all. Health must serve to reduce inequalities rather than to widen them. I thank you, and Florence, back to you. Thank you so much.
Now, ladies and gentlemen, we have heard the experience, and we've heard from our speakers a scene-setting and overview of several of the measures that have been taken and that are ongoing. And it's time to hear the Commission representative and ask her to set the frame for our discussion, for our panel discussion. So please welcome Commissioner Stelios Kyriakides, in charge of health and food policy. Good morning, Commissioner.
First of all, good morning, everyone. President Macky Sall, Dr. Tedros, Prime Minister, Minister, Executive Directors, colleagues, and friends. First, let me thank the President, President Macky Sall, and Dr. Tedros for really the way you have set the scene for what is going to follow this morning. A very important debate. And you have both touched on how the COVID-19 pandemic has brought our economies and our societies to an abrupt halt. And I totally agree, and we all voice the same, that we must not be caught by surprise again. For that, we absolutely need strong health systems and public health infrastructure. We need resilient supply chains, and we need diversified and even more evenly spread production capacities. We must deliver concrete responses to health threats, leaving no one, nowhere behind. The EU Global Health Strategy sets out a comprehensive agenda for action as we aim up to make the lost ground meeting the 2030 Sustainable Development Agenda health targets, to strengthen health systems and boost global capacities and combat health threats. The strategy is also a key component of Global Gateway to expand our health partnerships and build on our solidarity, based on co-ownership and joint responsibility across the world. And this is why we are mobilizing significant resources to support partner countries in building and improving the resilience of their healthcare sector. For example, through the MAV Plus initiative, Team Europe has already mobilized 1.2 billion euros to strengthen equitable access and production of safe, effective, quality, and affordable health products for Africa, in Africa, in line with the Partnerships for African Vaccine Manufacturing launched by African leaders. The EU partnership with Latin America and the Caribbean on health resilience and vaccine production is another significant example. But I will take up no more time. I want to just end these initial remarks, welcome you, and I look forward to hearing your proposals on how we can further strengthen our cooperation going forward. Thank you.
Thank you, Commissioner. Thank you very much, Commissioner Kyriakides. I would like now to invite our panelists to please join me on stage. Good morning to you all, and welcome. We've heard scene setting from our keynote speakers. Commissioner Kyriakides has also mentioned some examples of measures put in place and initiatives. And I would like to start with you, Madam Minister. How can Belgium specifically, and maybe as part of its upcoming presidency, but also the whole of the EU, how can it best support other nations and help local manufacturing of essential health products, particularly, of course, if we look at lesser income nations?
Thank you so much. Very good question, and nice to see you all. Some of them again. Dr. Tedros, Commissioner, President Macky Sall. I'm really happy that for the Global Gateway, health is a strategic component. I think that's very important because health, when I'm concerned, is a global public good. And we should invest in health as a driving force, as a catalyst for prosperity, for welfare, for development. And that's why I think it should be central in everything that we do. Belgium, indeed, is the upcoming president for the European Union. We start at the 1st of January, and we put health at the center of everything that we do. Because as a European, I strongly believe that we can only be healthy in Europe, in Belgium, when the rest of the world is healthy as well. And that's why I'm a strong supporter of universal health coverage, of universal healthcare systems, and I think there are some requirements that we have to deliver jointly. When we speak about health, we should talk about partnerships, and that's the only way we can make it work for the whole world. First of all, the first requirement is a universal healthcare system. And that needs, as the President already said, it needs a couple of requirements. It needs trained staff, it needs decentralized production, and it also needs a market where supply and demand can cooperate together. And that's why, as Belgium, in Team Europe, we support the MAV Plus initiative for decentralized production in Senegal, in Rwanda, in South Africa, and that's why we also met with President Ruto at the Univercel's factory only recently. So I think regulatory environment is important, especially for the private sector coming in. Trained staff is important for the deliverables of the universal healthcare system and products. And I think partnerships are evenly important, because when I talk to African leaders from time to time, they say, well, we have felt left behind during the pandemic, and we have to overcome these differences, and that's why the universal healthcare idea and the EU Global Health Strategy is that important. Let's mobilize all stakeholders, private sector, public sector, international organizations, and that's the way forward to make a difference.
Thank you very much. Mr. Sands, what kind of strategies is the Global Fund pursuing so that, in order to ensure that really healthcare systems, particularly in low and middle income countries, of course, are better prepared to respond to possible future health crises, and at the same time they need to maintain a secure supply of essential products? So how does the Global Fund support that?
To ensure people get the health services they need, you both need equitable, affordable access to products, and you need the health systems to be able to deliver them. The Global Fund was very much created 20 years ago with the mission of doing that, with an initial focus particularly on HIV/AIDS as well as TB and malaria. And it's actually a testimony to what can be achieved. When the Global Fund was created, putting somebody on antiretroviral treatment cost $10,000 a year. And as of this August, we secured another 25% reduction in the annual cost. It now costs $45 a year. So an incredible change over that period. But the challenge of getting, I think COVID-19, as others have said, demonstrated that we're still not where we need to be in terms of getting equitable, accelerated access to innovations. And so we are simultaneously supporting local manufacturing, and I can talk further about precisely what we're doing, because it isn't just a story about vaccines. We've got to do the medicines, the diagnostics, the medical devices as well. And we've also created a revolving facility which enables us to do advanced market commitments, accelerate access, and we're using this already for the latest generation of dual active ingredient bed nets for malaria. But just turning to the health system side of it, because it isn't enough, as we know, just to simply have the product. You've got to be able to deliver it. The Global Fund has significantly increased our level of investment in health systems. We are now the largest multilateral investor in health systems in the world, in low and middle income countries. So we're investing in things like the provision of medical oxygen, and supply chains, and community health workers, and laboratory networks, and disease surveillance, all the key components, but with the priorities very much set by the countries themselves. And to give a bit of a flavor, we'll invest about 1.6 billion in health systems this year, and that'll be going up to about 2 billion, this is US dollars, next year. So it's really important to be doing both, so supporting the manufacture and access to products, but also helping countries reinforce the systems that actually deliver the products and turn the products into services for the people who need them.
Thank you very much. Ms. Odi, how can initiatives like the Global Gateway support the expansion of the product capacity, particularly for mRNA products, and in regions in particular that have difficulties accessing them?
Thank you, Florence. I want to turn the question a little bit on its head before answering yours, and say that there's a lot that global health and global partnerships in health between private and public sector can do for the Global Gateway. And I think I heard President von der Leyen yesterday say something that I hadn't realized, even though I've been working in this field for a while. She said Global Gateway started with the vaccine manufacturing projects. This is a really important fact that I wanted to pause on, because now that we won the fight after COVID, and health is now alongside energy and telecoms and all the utilities seen as one of these long-term assets, long-term capital assets that matter for the economy. We won that fight. I don't want health to come back to be the poor cousin of the global gateway, waiting for money to be dished out nicely. It's really about economic empowerment. I think health is a global public good, so we should invest in it because it has more benefits than its pure cost, but it's also economic empowerment for all our partners on the global gateway. So with that in mind, what can Global Gateway do for us who are working hard in that space? I'd say two things, because we're in a room with such senior political decision makers, etc. I'm going to speak my mind. I think two things. One is market access. So as President Macky Sall just said, we can't possibly do all this work and then not be able to sell. And this is in our power. It's in the power of Gavi, of UNICEF, and they're working hard on changing the procurement. It's also in the power of the countries that procure. So as countries, we can decide where to buy, and it's going to be really important, and that's not going to happen at a technocratic level. It's going to need to have leadership from the very top. So create markets, and we, the private sector, with our partners like Institut Pasteur de Dakar, and Amadou Sall is here, who had the vision to actually raise that money, set up that project, do the leap of faith, and now look at where we are already. Same with the WHO mRNA program. If it wasn't for a few people inside the WHO who said 2 years ago, we've got to do that, we're going to do this hub, it wouldn't exist. And so now it's there. So trust us, if you sort out the markets, we'll be there. The second thing is, where it's a public good like training, like science and R&D, please invest in it as Europe. We do it for ourselves in Europe. Why not do it for low and middle income countries? There's no reason to ask for bankable projects for, what is discovery science and R&D and training. There's not a bankable project. You have to actually invest because there's a long-term gain, and you do it because you do it, and that's how we do it in the US, that's how we do it in Europe. Let's do the same in emerging markets.
Thank you very much. And indeed, you are here to speak your mind, so do feel free to do so. And that's actually for all of you. If you would like to bounce off something that another speaker said, of course, please feel free to do so. Dr. Ngongo, how can partnerships like the Global Gateway actually contribute to strengthening the healthcare systems in the region? And what specific benefits can it bring in your experience?
Yeah, thank you very much for the opportunity to also bring Africa CDC into this discussion. Very much appreciated. Africa CDC, as the continental agency in Africa, is confronted to the huge challenges of the weakness of the systems in Africa, and also the high vulnerability of our countries to outbreaks, to pandemic. Our main agenda is focused on two priorities. One is to strengthen the health systems with a greater focus on strengthening primary healthcare systems for resistance and also for equity. And then the other is the pandemic prevention, preparedness, and response, to make sure that, as President Macky Sall has said, that the continent is better prepared to face future challenges. Now, on the health systems, I think there are some considerable weaknesses that are there that we know. For example, the whole issue of the healthcare workforce is one of the main weaknesses of the health system in Africa. I think having a collaboration that really supports the continent and support the agency to strengthen that capacity in the continent will be really critical. The second major challenge is the infrastructure of primary healthcare in Africa. Really, the infrastructure is very weak. I say if you visit, you see that there are many health clinics that do not even deserve to be called health clinics. There's nothing of a clinic there that I just strengthen that infrastructure to elevate the level of the infrastructure is something that will also critically important. And another important pillar of the health system in Africa is the all drugs, essential medicines. Until now, we cannot guarantee really the availability of essential medicines in every single health facility on the continent. It remains a major challenge. I think that then brings to the discussion about what we are now talking about here, about the manufacturing, I think the local manufacturing. 3 weeks ago, we had a meeting that we convened in Morocco, in Marrakesh, in collaboration with Gavi, with about 13 member states and 8 African manufacturers, the most important that we know, from South Africa, from Ghana, from IPD. I think Dr. Amadou was there, represented with his team. I think the most important that we have in the continent. The aim of that meeting is to understand what is it that it will take really on the continent for us to be able to accelerate this local manufacturing. I think it was a very good interaction to have government as the public sector on one side with some of the ministers that were represented, having the private sector, the manufacturers also in the room, and also bringing even some of the development partners together around the table to discuss how do we move this agenda of local manufacturing. It is important, there are challenges, but we need to understand each other. Now, what are the problems that the manufacturers are facing? What are the problems that are coming on the public sector? What are the problems that the development partners can also help? Now, that meeting was useful in the sense that it identified some of the main challenges that are facing today on the African continent, the local manufacturing agenda. Because that was important for us, because as the Continental Agency, we have the Partnership for African Manufacturing of Vaccine, the PAVM that you mentioned at the beginning. Now, but the role of the partnership is to be able to bring everybody together to focus on a common goal, but also put common energies to address the key bottlenecks that are facing the continent. Some of them that were identified, the issue of capacity. I think that was mentioned here, capacity is really a problem in terms of infrastructure, in terms of the health workforce. I think that's so that we understand why that focus with IPD, for example, on talent development comes, because it is one of the major bottlenecks. We don't have capacity in local manufacturing on the continent. The second is the issue of market. You remember there was one painful experience where IPD, for example, had worked on a diagnostic test, but there was no market, that we needed really to ensure that as we enter into this market that is created. The third issue that was identified was the issue of regulation. That how do we then ensure that we have a fast regulation process that can help the registration of these countries? We have 55 countries. Are you going to be repeating the same process in every single country? It is cumbersome when it comes to African continent. That's why it came out clearly that we needed all of us to work through AMA as the continental agency that can help register and take the lead in the regulation, so that once the product is registered, then it can be used in all the 55 countries, taking also advantage of the free continental trade agreement that allows the free circulation of product on the continent. I think those are some of the things that really are important for us as we talk about systems. Is one side we strengthen the health systems, at the same time we also strengthen the local manufacturing. That is important not only to strengthen the system, because commodities are a major bottleneck in the current system of Africa, but also links it up to the health security in terms of how we prepare the continent for the future pandemic.
Thank you. Dr. Nsia Zare, I'd like you to share with us your experience. I mean, if we look at the supply chain security aspect of things, what measures has Ghana taken in order to ensure reliable access to these essential medicines that we were just talking about, and more specifically following COVID, of course, but also in anticipation of possible future crises?
Yeah, thank you very much, and the opportunity given to me. My president would have loved to be here, but he couldn't come. Yes, as our president said during the COVID period in one of the State of the Nation's address, that we want to turn the COVID crisis into opportunities. So straight away after African Union said we should try and do, we have only 1% of vaccines manufactured in Africa, 99% of them from outside. And what we saw during the COVID vaccines period, the vaccine nationalism and all sorts of things, we decided to join African Union and be one of the hubs for COVID, for vaccine production and other biologics. So we straight away set up a 13-member committee which worked for 1 year and came out of a 10-year roadmap. And I'm happy to say that Team Europe, in the delegation in Ghana, assisted us throughout this period, especially the European delegation in Ghana, and then GIZ and BMZ from Germany. They assisted us with all the technology transfer, and then assisted us to visit. We went to Universals, and we visited a lot of vaccine production factories in Europe. We came out of a 10-year project, 2 years for the fair short term, medium term, and the long term. What Ghana wants to do that in the next 10 years, we should be able to produce our own vaccines from discovery to fill and finish and packaging. And I'm happy to say that we are doing this with the private sector. So far, we formed out of Parliament what we call the National Vaccine Institute, which is an institute which is going to coordinate, facilitate, look at clinical trials, look at research and development, manufacturing, also the regulators. And I'm happy also to say that we have one of the strongest, very matured Food and Drugs Authority in Africa. It's maturity level 3 with the assistance of EU and the German government. We are slowly moving into maturity level 4. And we are not keeping it alone. We are also assisting other countries, like we signed our FDA, and the FDA of Rwanda have signed an agreement to assist them. So we've already started the AMA from Ghana. And then we are working together with also our sub-region. Last year, we had a 2-day meeting with Senegal, Nigeria, and Ghana, so that we don't crowd ourselves out, because we cannot compete with the big pharma. And if you want to produce biologicals like vaccines, serums, and the rest, then we have to be very careful that everybody will just producing everything and then we crowd ourselves. And we came out with a very good plan, and we believe that that's the way to go. What the National Vaccine Institute have done now, it has been established by Act of Parliament, as I said, by early this year. They are working and they are facilitating. We have 2 very strong pharmaceutical companies of broad footprints in the West Africa sub-region who have taken it up. DEK Vaccines Limited, who has already signed 3 agreements of 3 very strong manufacturing units in Europe and in India. And then also Atlantic Life Sciences. Only last week, Atlantic Life Sciences signed an agreement, and they are now have a bulk of anti-snakes. So they are producing anti-snakes fill and finish for the meantime. And we believe that in the next 5 years, we'll continue with our research and development, which we are also coordinating all the various research and universities in the country to come out with discovery of pathogens which can be formulated and then sterilized, and then we can have our own pathogens. So this is what Ghana is doing. And we are not working in isolation. We are working together with African Union. We are working with WHO, pre-qualification. We are working with other African countries. And we are working with our donor partners, both multilaterals and bilaterals, especially EU, which graciously, with GIZ, gave 3.17 million euros. And that is what we are using to improve and upgrade FDA to maturity level 4. As we speak, they are putting up a lot release system in Ghana, which is very important. They are doing a lot of technology transfer, and we are doing a lot of training. We are also working together with other African countries to do that. In fact, we are going to call another meeting very soon. My brother from Senegal will be called very soon. We will have to meet again to see where we have all reached, together with Rwanda, who has been working closely together with us. And during the UNGA, we also had a meeting with Bill Gates Foundation and then Gavi and WHO And we believe that we have to be part of what they are doing in Senegal for mRNA vaccines. So far, I'll say so good. And we are doing this thing because we believe that Africa should be able to achieve the 60% manufacturing of vaccines and other biologicals. And we in Ghana will also concentrate on malaria vaccines for the malaria endemic areas. So we work closely together with all organizations, all partners, both multilateral and bilateral, and especially with WHO, to be able to achieve this.
Thank you very much. Thank you for sharing all these examples with us. Ms. Genez, imagine we're here, well, it's not imagine, we are here to create an environment that really is conducive to attracting private sector investment. We've already talked about it. And these investments need to go both in healthcare infrastructure and in the manufacturing of products. So to do so, what key components must we bring around the table? What do we have to do as a first step, or second or third?
Yeah, let's say second, because we have already started, which is a good thing. I think we all agree on the fact that we need strong universal health coverage and that we need a market. And that means that we have to invest in market shaping and in creating an ecosystem where all stakeholders are involved and all stakeholders define the same and the right goals to aim for. I think that's very important. And everything has been said this morning. We have talked about accessible, available, accountable systems and products. We have talked about the workforce. We have talked about tech transfers, about knowledge, about investing in R&D. As a Belgian minister, a Belgian national, well, I can say we are a small country, but we have a very strong, innovative pharmaceutical industry. And that means always investing in the same essentials, and it is knowledge, it is infrastructure, and it is a strong regulatory framework. And I think that's what we can put at offer also for our African partners. We have a strong cooperation, bilateral, Belgium and Senegal, for instance. But within the Team Europe initiative of MAF+, the building blocks become more solid, stronger. And if we have a strong system in Senegal, well, why don't we export it to the rest of the African Union with the help of the African CDC and all private sector investments? So I think we all know what has to be done. We agree on what has to be done. So the aim is and the goal is, let's put our act together and let's move forward and step up to cooperate even better. And that's why I can stress it only once more. From January on, health will be at the center of the EU presidency with a focus on the strong partnership with Africa, with a focus on decentralized production, but also with a focus on, for instance, SRHR, sexual and reproductive health and rights, because I strongly believe that when women are safe and healthy, societies thrive. So that's the feminist speaking at the end of the line. Thank you.
Thank you. Yes, please, Mr. Ngongo, would you like to?
Can I just add a word on what she just said? Very important. Is that this has to be, in practice, a real partnership, a kind of win-win partnership between the private sector and the public sector, each playing his role or its role to make sure that we all come to the desired result. Why am I saying that? As the private sector makes this investment, I think we're part of the announcement of Gavi, 1 billion invested over 10 years. Now, there's also, Europe is also putting $1 billion, as it was just mentioned here. Then that whole issue of the market becomes critical to be able to create the demand that is necessary to sustain all this effort over time. Now, what is happening right now with the AU is that thinking ahead, we've already started the process through Africa CDC of developing a legal instrument that will be supporting the pooled procurement. It's a pooled procurement mechanism that will do two things. One is secure the commitment of the member state to buy African-produced products. And then secondly, is secure the commitment of the member state to buy together to be able to create then the economies of scale that we need to be able to lower the prices and then sustain it. Just to say that very good initiative, but we are working on both sides, both the private sector and the public sector coming together to be able to sustain this effort.
Sorry, you wanted to intervene?
Yeah, just picking up on that point of the, what products and what technology, just to complement this, because I completely agree we are now entering a delivery and execution phase. We have to stick to it and, keep at the job. But from where we come in Univercel's group, we really see the world through the lens of technology innovation that allows you to lower the cost of production and therefore decentralize and democratize the means of production of these products. And so what it means in practice, I think, is that with mRNA, for instance, you're looking at the potential of not having our global partners, countries, at the receiving end of licenses. We should start with that. I'm not saying we shouldn't do that. This is part of the equation. But we're also empowering ourselves to be the new inventors of products. And this is why the vision of IPD is so important, why the work that we do through the WHO with partners across the continent, including in South Africa, is so important, because this is where you see the value of the future and what we call leapfrog. So not copying, not waiting patiently for 60 years for whatever happened in India 60 years ago or in Europe, happens in Africa or in LATAM. It's really a more proactive vision of this plan, of executing this plan, which is putting the life science inventiveness in the hands of more people. And I think that's why we're so excited about our mRNA technology, which does exactly that with the support of partners and the Gates Foundation, et cetera, et cetera.
Mr. Sands.
Yeah, could I just jump in on this? Because I do think that getting and I come from the private sector, getting the supply-demand balance right in the way that we progress this really important move to decentralize manufacturing is right. Otherwise, we will end up with factories with no one to sell to, with economics that won't work. And so certainly what we're doing at the Global Fund, and we procure a couple of $1 billion worth of medical commodities every year, is we're starting from the demand side, because we can bring the demand. And so, for example, in August with WHO and with PEPFAR, we launched a call for proposals for African-manufactured HIV rapid diagnostic tests. And we know we can solve the demand side of it because PEPFAR and the Global Fund together are the dominant players in the market. And so the issue, and there is not going to be a problem with financing, the technologies are relatively stable. The issue is going to be what's the speed that we can navigate these things through the various regulatory hurdles, be it the PQ process or local regulatory approvals and so on. And I do think this is one of the most critical parts of the whole thing, is that the regulatory stuff at the local level, at the regional, continental level with the AMA, and at the global level with WHO is probably the most complicated and difficult part of this whole equation. And there isn't a simple answer, because we don't want to compromise on quality standards, but we need to find ways of making it work faster. Because you can't open a new factory and then sit around for 2 years waiting for PQ approval. The economics of that doesn't work at all. And I was in the frustrating position you mentioned, Institut Pasteur, with the COVID RDTs. We weren't able to buy those because they weren't PQ'd. And so we need to find a way of cracking that. We're not stopping at RDTs. Next week there's a conference in Maputo which is about antiretrovirals. The sad truth is that there will definitely be sustainable demand for antiretrovirals in Africa for a very long time to come. And again, we're doing it with WHO and PEPFAR. And so again, we can ensure sustainable demand. And we're doing the same thing around insecticide-impregnated bed nets. Again, we can guarantee where Global Fund is 50% of the world market for bed nets. So the demand is there. We can ensure that. So I do think this is the 2 points I'd make here. One is you got to get the demand, and you need to know that it's there before you invest too much on the upstream end. And two, the work that needs to be done at multiple levels on the regulatory frameworks in which these new products are going to be approved and then with guidelines that are going to be deployed is absolutely critical. And as I say, it isn't just for WHO, it's also at the continental level. It's also at the individual country level that needs to be the case. So we're working very closely with WHO and Africa CDC on that at the moment, because my worry is that is actually going to be the thing that slows us down most.
Ms. Genez, would you like to comment on that, maybe?
Yeah, I couldn't agree more. We had a discussion in New York lately, and Macky Sall also referred to it. If Africa produces, let's say, vaccines, South Africa, for instance, and they buy their own vaccines in India, then there is a problem. So it's all about market shaping. I couldn't agree more. And the supply and the demand side, well, they have to meet. And that means that you have quality control, that you have regulation, that you have a framework that shapes it all and that brings it all together. And I think till today, that's where Africa can improve even more. But yeah, all the knowledge is here and everybody agrees. So it's more a question of let's act and let's combine efforts. And that's why an initiative like the Global Gateway and the EU Global Health Strategy and the EU-AU partnerships are so important. Now it comes up to the deliverables. Also in 2022, the EU and the AU agreed on the global health strategy and the universal health strategy. And now it's about production, and it's about training, and it's about markets, and it's about combining efforts. And I think the time is now.
Sorry, can I just add one other thing, which is on pricing and the willingness to pay premiums for locally produced product. Certainly at the Global Fund, we are prepared to pay a premium for diversification of supply, and also we look at the costs on a delivered basis. So obviously, if you're supplying to Africa and making in Africa, you avoid the logistics costs. However, and we also are prepared to pay a premium to, in a sense, get things going, to improve the breadth of supply. But I think we need to be very careful about locking in paying premiums, because frankly, that ends up as rent seeking by advantaged producers. And the history of, there's plenty of history in the world. I mean, if you look at the history of local production of first-line TB drugs, it's a history of rent seeking and deteriorating quality. And that is not something we want to replicate. So I think it's that part of it has to be managed extremely carefully if it's not actually to end up 10 years from now with actually reduced access because people are having to pay a higher price than is available on the global market. So it's not to say a price premium isn't, it can be appropriate, it is appropriate, but it's a temporary transitional thing to enable the decentralization to happen.
Okay. Ms. Audi, I see you're ready to intervene. A quick remark, because then I'd like to open the floor.
If there's 1 minute, I would say this is incredibly important. We cannot set the system to be more expensive forever after, because that will not work. Technology brings some solutions. So our viral vector bioreactors that are now at IPD really help having smaller scale factories, but still reach the same price point that's acceptable by the market. We think mRNA hold a lot of promises on reducing reduce price. But there's another element that it's not technology alone that's going to fix it. It's you need to localize some of the intermediate goods in the supply chains on the continent, because the cost of a vial is the cost of a vial. If I need to import it from India, I just add that cost plus transport, and it's not going to work. So there's less sexy things that need to happen where our kind of technologies and the other biotechs, they're not right now solving that. So we need really people to focus on solving the supply chain elements.
Thank you very much. So I'd like to open the floor. Yes, please. We have the gentleman here. Dr. Tedros, maybe first, and then I'll give you the floor, and then the gentleman.
Good morning. Your Excellencies, good morning. Dimitri Enigal, Médecins Sans Frontières. For more than 20 years, we've been working to address inequities in global access to medical products for HIV, cholera, snake bites, etc. So we really welcome the high-level political attention on this global problem. But we also think that it's important to learn from some concrete cases, such as the one that we witnessed. So I would like to briefly share 2 concrete examples. One of them, access to Ebola treatments. There are 2 safe and effective Ebola treatments. Quite a number of actors represented in this room have been involved in the research and development. Ministries of Health, researchers from affected countries, France, us, Médecins Sans Frontières, the World Health Organization, Red Cross. There has been significant public funding. The private sector was obviously strongly involved. But the reality is that almost all doses that were produced are now stockpiled in the United States. Affected countries have to rely on ad hoc donations if there would be an outbreak. The products are not even registered in the countries where the disease is about to or could potentially have an outbreak. So really, you have a major challenge there. And secondly, as briefly noted by Mr. Sands, I really want to highlight the lack of access to affordable and quality assured diagnostics. It's often overlooked, the aspect of diagnostics, and it's a key problem for us. Without proper diagnosis, we are blind. I could focus on lack of access to TB diagnostics, a curable disease that still kills 1.6 million people around the world. And despite the fact that we have seen with COVID-19 that rapid diagnostic tests can be easily, abundantly available. This we have seen during the COVID-19 pandemic here in the EU. So we have to learn from this experience. And we should see at how we can help low and middle income countries produce these. And in all these elements, the technology transfer has been mentioned before, is really key. Technology transfer for local production of all these tools. And this is a really important element. From all our experiences that we have learned, we cannot just rely on the voluntary actions of private companies that hold the exclusive rights over these products. So my question to the panel would be the following. Considering the huge investments, public investments that are about to take place, which kind of requirements would you like to see attached to these to really make sure that this ambition of local production and global access is a reality? And a second question, how should the EU translate this ambition, that we support, into the negotiations of the pandemic treaty? Which kind of mechanisms should be there to ensure the equity or prevent the inequities that we observed during the COVID-19 pandemic?
Thank you. I'm Edouard Ngirente, the Prime Minister of Rwanda. I want to just say something, but first of all, I want to thank President Macky Sall and Tedros and the Commissioner for their keynote speeches. Everything has been said. But I want to say that as African continent, we are now very happy that we are on the same page. We have a common understanding between us and our partners that health product manufacturing is a top priority for Africa. It's not a choice, it's a necessity for us. At least now we have a common understanding on that. I want just to mention something about education, education side, because as everyone has mentioned, there is an issue of capacity building. And I want to share what we are doing in Rwanda. While we are setting up the vaccine manufacturing plant in the country, we have also anticipated, and we are establishing now, we are putting in place an African Biomanufacturing Institute that is going to be a training center for all Africans who want to be trained as a professional in that field, so that those are the people who will be working for those manufacturing plants in Africa. So it's not a Rwandan institute. Every African who want to be trained that field will come to be trained in Rwanda, and they will be having some courses out of Rwanda. So I want just to share that experience that we are anticipating the shortage of professionals in that field. Thank you so much.
Thank you very much. So then, Dr. Tedros, I don't know whether it was a question or a comment, or...
It's a comment, so it's better if others can get a chance.
Okay, we had a question from the gentleman over there next to the wall. And then we'll give you the opportunity to get back.
Hello, my name is Jan Pomowski. I'm from the Guild of European Research Intensive Universities, and I want to thank you first of all for really stimulating an important discussion. My question really is about non-communicable diseases. I've heard a lot about communicable diseases, but of course the growing number one cause of death in Africa are non-communicable diseases, and of course they have a fundamental impact also on how individuals respond to communicable diseases. So how does that feature in this relationship? I've just been to Senegal, and I've witnessed how His Excellency Macky Sall is also including a center on non-communicable diseases in the health hub near the airport. But can you just say a little bit more about that?
Right. So who would like maybe to first answer? Yes, please, sir.
Yeah, we've also realized non-communicable disease is something which is surging in Ghana. We have a unit within the Ghana Health Service which looked after non-communicable diseases. And what the policy is that every health facility should have at least the adult, we call it adult weighing, so that adults will go to a clinic which will be taken care of by the health insurance and have at least, I say, the date of your birthday or the month or the week. You just walk in. Because non-communicable disease, if you pick it up early, diagnose it, you treat it, it will not end up in very bad, especially we're having a lot of young people who are having end-stage renal problems. And dialysis has become a problem. It's not only dialysis, which is very important, even transplantation. So we want to pick it early, and then also changing lifestyles will be nutritionists and people who are advise them so that we can at least minimize all the very bad cases that we are seeing. That's the first case. The next case is that we want to also make sure, as part of the post-COVID recovery that we are doing in Ghana, the government is putting up massive infrastructural development, which we call Agenda 111. So we realized that about 88 of the 261 districts in Ghana didn't have what you can call a first referral center. So it means there's not even a physician in that district of population of about 240,000. So we are putting 101 district hospitals across the country where we don't have it, so that we have the first primary referral center and the people can be seen quickly. We are digitizing our system of telemedicine so that it can also have support from the higher centers. And then we didn't leave only for clinical care, but we also look at mental health services. And we are putting 2 regional mental health services in the zones, so that the southern zone have all the mental health facilities. We are putting one in the middle zone and the one in the northern zone. And then also secondary care for the regional hospitals. There are 6 new regions which have been developed. So if you have all these things, then we can then tackle these things. Those who go for checkups and those who are sick can then have access. We don't have to travel a long distance, and this is what we're using health insurance and using also other reinsurance system to be able to tackle the non-communicable disease. In addition to the biomedical, plans that we are putting up, that we can develop other biologics which can then treat for example, cancer cases and other non-communicable diseases. That is how we are doing it. So COVID is turning into something else. We want to turn it into opportunities. Thank you.
Thank you. Mr. Sands.
I just want to pick up on the point about diagnostics. Diagnostics too often are a bit of an afterthought, and if you look at the priorities for the AMA or the transition from SRA to WLA and WHO, the regulatory processes, the diagnostics bit of it tends to be the bit that is moving slowest. And I think we need to change that. And if I may be a little bit controversial, I would say this whole discussion is a bit too vaccine-focused. we were lucky with COVID-19 that COVID-19 was vaccine susceptible. We should not assume that the next threats are going to be vaccine susceptible. So we are also going to need monoclonals, antivirals, diagnostics of various sorts. So as we have this discussion, we should be looking at, across that broader canvas. And I do think one of the bigger challenges, which I think is the next challenge coming at us, is that the pace of technological development in the global north on things like gene therapies, biologicals, all the kind of precision medicines is such that if we're not careful, we're solving an old problem of small molecules and established technologies, and that there's a new set of inequities developing because we need to find ways of transitioning those technologies for local manufacture and local delivery. Because one of the big issues around some of these newer technologies is actually the requirements for the health system to be actually able to deliver them are a whole step further than the requirements of the current technologies.
Thank you. Ms. Aude, you wanted to come in. Ms. Genèse, two very, very quick points, please. I'm afraid I'm not going to be able to give the floor to everybody because I'd like to give the floor back to Commissioner Kyriakides as well.
So on the NCDs, insulin, monoclonal antibodies for cancer and autoimmune diseases, even further on the horizon, treatment for sickle cell. These are all things that we're really, really interested in. It's not easy. They each have different markets and different technologies. Some can be scaled. Some really need to be scaled up to be affordable. Some we think we have solutions. We're on it. We want to be on it. We want to partner on it. I just want to very quickly comment, just picking up on what, the gentleman from MSF said. I can feel you, like when you see what MSF did with the Nobel Prize and set up DNDi and then later set up GARD-P for AMR, you can really feel that this stuff has been done before. You must be sitting there looking at other people saying, like, we've been saying this for 20 years. I think it's a great victory for global health and for those kinds of partnerships, that it's becoming completely mainstream. And it's true that a lot of the network of DNDi is the network that we want to exploit today, and it's been there for years, and that's great because we'll build on it today.
Ms. Genèse, very quickly, please.
Yeah, to conclude, I couldn't agree more on the diagnostics point, because we risk to have, because of COVID, we risk to have the focus on vaccines, and I think that's a problem. If we all agree, suppose, that we all agree that health is truly a global public good, we should talk honestly also about tech transfer, because now we discussed return on investment, but I think it's even more important that we discuss the return to society. And it's a common interest that we discussed also waivers, tech transfers, and that all partners are in it together.
Thank you very much for opening that new path. I'd like to give the floor back to Commissioner Kyriakides for a few closing remarks here. You can probably come up on that side, it will be easier.
So thank you very much, everyone, for this very important input. And I believe that the discussions today have yielded both thoughts and ideas that allow us to go forward. And one of the themes that I felt went through the discussions today was that of our strategic partnerships. And these need to be partnerships that are really side by side with one another, and these need to be at the core of all our international efforts. It's of course no coincidence that the Commission has a department specifically dedicated to international partnerships, headed by my colleague and friend Jutta Urpilainen. And yes, our biggest focus at the moment is Africa, because we all know that currently Africa imports over 99% of its vaccines and 94% of its medicines. But with the right incentives, we believe that we can really induce pharmaceutical companies to invest in increasing local production in Africa for Africa. And the aim, as I said at the beginning, is to make this continent less reliant on imported goods and to create the right enabling environment for sustainable production and to ensure better availability and access to quality not only to vaccines, but also to medicines and health technologies, as has been mentioned. At continental level, we're supporting the establishment of the African Medicines Agency, the mRNA Technology Transfer Hub, and the Partnership for African Vaccine Manufacturing Strategy. It's very inspiring to see country-led projects such as that mentioned in Senegal, as we have heard earlier, and across the continent now starting to really deliver and to take off with the support of EU private and sector involvement. Later this year, President von der Leyen will be in Rwanda to see more biotrainers from BioNTech arrive and to increase the production facilities for vaccines. And we know that in South Africa, BioVac has already started producing COVID-19 vaccines, and these facilities could also be used to produce essential medicines. And it is important that we have this diversification of essential medicines and other vaccines in mind. In Nigeria, the EU is contributing to local production of antimalarials, and here I want to take the opportunity to thank member states such as Belgium, France, Germany, Netherlands and Sweden for their involvement in MOVPLUS and invite other EU member states to join this. Belgium has made and will make access to quality health services linked to social protection in the upcoming presidency. I'm very much looking forward because it does have a very strong health focus in this presidency. And I'm equally pleased that mental health was mentioned today, because this is really becoming a priority in many of our parts of the world. Our efforts to reinforce strategic partnerships globally go beyond Africa, and in 2022 the EU Latin American Caribbean Partnership on Health Resilience and Vaccine Production was launched, and in February this year we created a virtual matchmaking platform for health and pharmaceutical companies from both our regions. We also held a high-level pharmaceutical forum and set up a workshop between EU and Caribbean community regulators. So we really need to look at what we're addressing here today globally, and we will continue to work this. There are already initiatives in Costa Rica, in Mexico. I will not go into this detail here, but I want to just end by saying that public and private partnerships which have been mentioned are the cornerstone of the EU's 300 billion euro global gateway strategy. We build a partnership of equals with partner countries, and this is built on joint responsibility and co-ownership. And investing in health is central to our effort, where we're working to look for opportunities linked to research and digitalization. We're supporting the development of horizontal capacity, which is essential for sustainable access to medicines. We need to boost research. We need to improve the regulatory environment. This was also mentioned. And we need to look at the issue to do with healthcare workforce and technology transfers. And Global Gateway will be prioritizing secure pharmaceutical supply chains and local manufacturing opportunities. And my final last words, hearing everyone today, I think that it's important that we understand and we all share that deepening our partnerships and our promise to deepen our partnerships will bring us all mutual benefits. And for global health, this requires all countries in the world to work together. And this is the only way that through our EU Global Health Strategy we'll be able to deliver long-term health and well-being worldwide. And we do this because we need to reduce health inequalities, and we need to strengthen health systems, and we need to have equitable universal health coverage, and we need to also be able to really talk about leaving no one behind and know that we have worked in a way that we have truly meant it and does leave no one behind. Thank you so much for today. Thank you.